Welcome to Securing America with me, Frank Gaffney, the program that's a kind of owner's manual for protecting the country we love against all enemies, foreign and domestic, to the glory of God and his kingdom. Well, one of the glories of God, in my personal estimation, is Dr. Peter McCullough. He is a man who came to national attention by having the courage to fight COVID-19 in an honest and forthright and effective way. You wouldn't think that that would necessarily distinguish a medical professional, especially one as distinguished as Dr. McCullough was within the medical practice in the United States. He's a top tier cardiologist by training and has been writing peer reviewed papers and otherwise leading the the people who practice the Hippocratic Oath for decades. He is, I'm proud to say, a personal friend of mine, as well as an enormously important inspiration. And I think you all know him, among other places, for his appearances here, but I hope you know and admire him, as do I, for what he did in the COVID-19 pandemic to try to help people actually understand that there was a better way to treat patients, especially to treat them early on, than the way they were being told should be practiced, which was stay until you're so sick you have to go to the hospital, and then they'll intubate you, and then they'll give you remdesivir, and then you'll die. And over 1 million or so did just that. We're going to explore with Dr. McCullough his experiences, the insights that he garnered from them in the course of the pandemic, specifically as they relate to the impending action of the World Health Organization to make the man who prescribed that disastrous way of treating COVID-19, among other acts of malfeasance, and turn him into the global dictator of public health. This may sound unimaginable, but that is what is afoot, folks. You've been following it here in the course of the past year or so that we've been talking about it on this program. But we're going to talk with one of the men who is standing against the idea of having the World Health Organization's Director General tell us in the future what he advised us to do in the past as a result of not one but two treaties that are now almost complete, we're told. They're supposed to be approved by the World Health Assembly, the sort of UN General Assembly version of the World Health Organization, in a little over a week's time. Unimaginable. Peter McCullough, thank you for taking a full hour of your time to share your thoughts on all of this, as well as your life experience. It is a real privilege to have you with us always, sir, but especially to do so at a time such as this, as it says in the Bible.
Well, thanks so much, Frank. You're right. There is no more critical time than now in securing America. So let's get after it. I know you have a lot of critical updates.
Well, I do. Well, let's start with what happened Friday of last week. We were told that a deadline that had been established for completing work on this pandemic treaty had been missed. And some on our side thought, oh, praise God, we've been spared this prospect of a disastrous treaty being approved by this World Health Organization at the end of May 27th to June 1st, to be precise. We learned almost immediately thereafter that not so fast. They're just going to extend the deadline for another 2 weeks. And the practical effect of that, Peter, as I understand it, is they're not moving the date of this meeting. They're just exhausting the amount of time that we might have to actually see their handiwork, to assess it, to evaluate it, to debate it, and to make informed decisions about it. Give us a sense, sir, of what the stakes are as you see them from your perspective of this pandemic and the guy who brought it to us.
The World Health Organization is a behemoth. It is an organization that has 8,000 employees, over 140 member states, an organization that in the last 5 years has been a disaster in the COVID-19 pandemic. They fully participated in the cover up of the origins of SARS-CoV-2, the Wuhan Institute of Virology, that is controlled by the Chinese Communist Party. That's just for starters. Then we had the World Health Organization deceive the world on early treatment. That was the only chance of preventing hospitalization and death. The World Health Organization crafted a false narrative that we should wear masks, lock down, social distance, and wait to be saved by a vaccine. And of course, the COVID-19 vaccines were not safe. They were not effective. We're picking up the pieces after this mass vaccination debacle. It's all at the hands of the WHO. Now they're advancing this pandemic treaty agreement, alliance, and international health regulations. We're supposed to have 90 days plus for review of all documents, because it's not just, staffers that need to review it. Doctors, others in the public health sphere need to review it. And what they've essentially done, Frank, as you pointed out, is they've run out the clock. So we can't see what's going to happen.
And again, we're going to come back in short order to what, you saw when people were told, do what you're told, follow the World Health Organization's prescription, follow what came to be called publicly the China model, in fact. But before we do, just to round this out, I think 2 points I might adjust, if I may, in what you've said. It's actually, I think, 194 nations, essentially the entire world, is a party to this organization. And we are supposed to have, by its own regulations, 4 months, not just 90 days, but 4 months in which we will be able to review whatever they're proposing in the way of just these amendments to regulations. So a new treaty that depends on those regulations, of course, has to have more time to be studied as well. So this has given rise, Peter, as I think you know, to a very important initiative of our Sovereignty Coalition, co-sponsored by our Center for Security Policy. And I encourage everyone, stop what you're doing, aside from watching us, of course. Go online to centerforsecuritypolicy.org. You'll find prominently there on its homepage the Sovereignty Coalition's initiative. We call it the Not Now campaign. Not now, not this World Health Assembly meeting to do any of this stuff. It is not ready for prime time. And people like Dr. Peter McCullough, our distinguished guest, need to be able to take a close study of this as the time required to inform us about whether what the World Health Organization is doing is consistent with our national security interests, with our Constitution, including the rights of our states to make health policy in our country, not a federal authority, and most especially, and we'll come back to this on the other side of a very short break with Dr. Peter McCullough, they are proposing to compromise your personal medical freedom in a way that may well, in a future pandemic, as we saw it do in the last one, result in your untimely death, because the advice you get is not that from a doctor like Peter McCullough, but from a guy who's not even a medical doctor like Tedros Ghebreyesus. A lot more ahead in this very important, very timely conversation with one of our great medical practitioners in the United States, Dr. Peter McCullough, co-author with John Leake of The Courage to Fight COVID-19. Stay tuned. We're back. Dr. Peter McCullough is visiting with us and is sharing his thoughts, his experiences, his insights into the real dangers that are associated with people who are not, frankly, competent to make professional medical judgments, nonetheless being empowered to dictate how your personal medical health decisions will be affected. Um, Peter, talk a little bit about the doctor-patient relationship as you experienced it being mutated almost beyond recognition in the course of Dr. Tedros's treatment, shall we say, of the pandemic COVID-19.
Frank, I've been treating and patients face to face now 5 years into the pandemic. I've been on the real front line, which is managing patients, helping them avoid hospitalization and death. That's our overarching goal. In pandemics, basically, almost everybody gets to the disease. It's honestly a misplaced set of efforts to try to, in a sense, prevent acquisition of the disease. We have to prevent hospitalizations and deaths. The doctor is in a fiduciary relationship with the patient. That is, it's an unbreakable private circle of care that focuses on the principle of beneficence. That is, what's in the best interest of the patient with full informed consent. And under no circumstances can any patient receive any pressure, coercion, or threat of reprisal. And what we saw in pandemic response really led out of Geneva by the WHO is a complete erosion of that doctor-patient relationship. The fiduciary circle was broken. Patients could not get the care that they deserved. Doctors felt completely infringed upon their professional abilities to take care of patients. Pharmacies, because of the WHO and this downstream set of dictates, pharmacies didn't dispense medications to patients. And as a result, Frank, patients were unnecessarily hospitalized, and sadly, some died, all at the hands of the WHO.
Yeah. Peter, you and I've talked, I think off air, but maybe on as well, but I'd reprise this point because it's so important just to calibrate the dangers associated with all of this. I believe you have told me that in your professional estimation, having watched this travesty, that perhaps as many as 80% of those who perished in the course of the COVID-19 pandemic, in some association with the disease, obviously, did so needlessly. Did I get that right? And again, does this come back to, well, I would put it starkly, blood on Tedros's hands? Not alone, but his leading role has to be acknowledged here. No?
I was the lead witness in the historic November 19th, 2020 U.S. Senate proceedings. I basically broke the news to America and the world that we could treat COVID, prevent hospitalizations and deaths. And through my Senate testimony, as well as my EU Parliament testimony, we started out with probably a preventable fraction at about 67%. Now full on, you're right, it's probably about 85% of all the hospitalizations and deaths could have been avoided. What could the WHO have done? They could have basically injected doctors with the full force of everything they need, every tool and resource they need to take care of patients, save lives now. They should have, if anything, just supported what we were doing. McCullough protocol was the most widely used protocol worldwide. It was fully embraced by the Association of American Physicians and Surgeons. WHO should have embraced us in meetings right away. How do we standardize this across the world? I helped groups in Honduras and other countries, with their pandemic response. The WHO wasn't helping us; they were hurting us.
And just to put a fine point on it, sir, your protocol relied on, as I understand it, not only common sense that early treatment would be preferable to late and perhaps deadly mistreatment, but also the use of widely available, safe, inexpensive therapies rather than these experimental so-called vaccines. Just remind us of just how far we departed from standard practice.
Right, the McCullough protocol started with risk stratification. Not everybody needs treatment, but the high-risk patients, deserve a good go at treatment. It starts with simple virucidal nasal sprays and gargles, something the WHO has never analyzed or promulgated, supported by a great number of prospective randomized trials. Nutraceuticals and supplements, we had very strong data for vitamin D as an example in that category, but many others. But vitamin D, WHO never supported vitamin D and its role in acute COVID-19. We went to antivirals, hydroxychloroquine and ivermectin in the first 2 years of the pandemic. We didn't have anything else. Then later on, Paxlovid and molnupiravir, the antibiotics, doxycycline, azithromycin. Sadly, many patients died of secondary bacterial pneumonia, something the WHO never messaged us about or helped the world through. Corticosteroids, colchicine, and then on to anticoagulants. But let me tell you what, the WHO was not a place to look for leadership on pandemic response. In fact, they misled the world, and it would be a disaster for the WHO to be in charge of the next pandemic.
Yeah. The question that occurs, of course, is who benefited from all of this? Who was driving the decisions that were being tendered? And again, I cannot emphasize this enough, folks. This was all advisory. Tedros did not have the power to make anybody do these things. But it was translated, and let's give some, discredit, I guess I would say, to people like Tony Fauci and Deborah Birx and Francis Collins and others who essentially translated that advice into essentially, the kind of force of law that, as you say, prompted physicians, yes, and pharmacists and medical associations and universities and all the rest to say you have to do this. And Peter, we're going to come back to what happened when you crossed them, but Quo Vadis, who was the Cui Bono, I should say, not Quo Vadis, Cui Bono, the beneficiaries of getting these vaccines as the course of treatment would have included who?
Yeah, I'll give you a couple of beneficiaries right off the top. Look at the Chinese Communist Party, and they basically were protected from any investigative scrutiny over the Wuhan lab by the WHO. Who's a major funder of the WHO? The Chinese Communist Party. To this day, the Chinese have been off the hook on the origins of SARS-CoV-2. How about the Gates Foundation? Another major supporter of the WHO. Gates Foundation has a perfectly timed investment in BioNTech, the German vaccine company, and reaps record rewards on this perfectly timed investment. Gates, WHO, the Chinese, they were all in this biopharmaceutical complex to front vaccines as the only strategy for the world to take in order to manage through the pandemic. And what a disaster that was. Those are just two major beneficiaries.
Yeah. I was going to say, in addition to Gates as an exemplar of kind of big pharma, he claims, as you know, Peter, to have gotten 20 times return on his, as you say, brilliantly timed investment. And given the intimate relationship between Gates, the foundation, and these various other entities that he's cooked up, and the WHO, it's no accident, comrade, as the communists used to say, and it speaks volumes about the problem that we're likely to face if these guys are able in the near future to begin telling us what vaccines will be taken. We're going to talk about those vaccines more with Dr. Peter McCullough straight ahead. Please stay tuned. This is an extraordinarily important moment because we're down to the wire, as he said, on the WHO, and what it could do to you in the next pandemic crisis or perhaps some other public health emergency of international concern. Be right back. We're back. We're continuing this hour-long, extraordinarily important and exceedingly timely conversation with Dr. Peter McCullough, one of America's, one of the world's foremost medical doctors, a man who has been revered, until very lately, I think universally, for his understanding of medicine and his exceedingly skillful practice of it. And I say until fairly recently because Peter McCullough wound up coming afoul of the World Health Organization and uh, its allies in our government and the media and others under their influence because he spoke the truth about, in particular, some very problematic so called vaccines that were very, very quickly cooked up to deal with the COVID-19 pandemic. And Peter, I want you just to lay out quickly for us, if you would, the actual uh, testing, the experience that we had with these so-called vaccines that got them an emergency use authorization and subsequently mandated use, including notably by the United States military. I mean, just you're talking about the biopharmaceutical industrial complex run amok. Give us your personal experience with that, if you would.
Frank, I was the only public figure in the world to put in writing an op-ed widely read by the House, the Senate, the White House, people across the globe in The Hill. And the title of the op-ed in August of 2020 was The Great Gamble of the COVID-19 Vaccine Development Program. It was a gamble because these vaccines were the genetic code for the lethal Wuhan spike protein, the protein that was devised in this biosecurity lab in China. And there was
And
no
you have
way.
no doubt about that, sir,
Yeah,
do you?
no, that's fully accepted by all the government agencies now, Frank. Listen, there's no way to shut off the genetic code once it starts to crank spike protein in the human body. An incredibly dangerous proposition. We're talking about Pfizer, Moderna, Janssen, AstraZeneca, the Russian Sputnik vaccine. No way to shut off the production of the spike protein. The spike protein we knew would damage the heart, the brain, the other organs, cause blood clotting. I mean, what a disaster. It's a disaster by its own design. And then the testing, the Pfizer was the first one, Frank. It was just 1 month to get the primary series and then 2 months of observation. No one could have known at month 4 or 5 what was going to happen. And so we learned on the fly. Large numbers of people began to die after taking the vaccine. Pfizer knew about 1,223 deaths in their 98 data dossier that they blocked to America for well over a year. Worldwide, every safety system started going off the Richter scale with deaths. These deaths are reported by doctors like me who have already decided the vaccine is the cause of death. In the United States, as we sit here today, we're at over 550,000 estimated Americans who have died of the vaccine. That's actually more than who truly died directly due to COVID. The same is true worldwide. Multiple calls to pull these off the market, and the World Health Organization has been deaf to any of our concerns.
Could you contrast this with past experience with um, vaccinations or other injections that were demonstrably problematic, but nothing, as I understand it, compared to what you've just described? What
Nothing.
was
Good
done with them?
example, 1976 swine flu pandemic. Aspiration to vaccinate the entire country. A quarter of the country took the swine flu vaccine. About 24 deaths, 500 cases of Guillain-Barré syndrome. No Twitter, no internet, no data safety system, just good old common sense. Gerald Ford administration, pull them off the market, apologize, and then actually make reparations to the damaged families and patients. I mean, this has been an atrocity. And you know what? It's worldwide because the WHO is behind it.
Right. Peter, one of the things that I'm struck by, you've focused in those remarks on the number of deaths, over 500,000 in this country alone, as a direct result of these gene therapies. But that doesn't take into account the number of people whose lives have been wrecked or simply harmed in substantial ways. I've been told that in the military, something on the order of 1 out of 9 people in the ranks has either died or been permanently impaired
Oh,
or temporarily very substantially uh, adversely affected, and that among the general officer ranks, it's at 1 out of 8. I mean, these are staggering numbers, especially when you talk about our national security. But talk a little bit about what you've experienced in your efforts to treat patients, to help them deal with the effects if they didn't die, and that larger toll that's been taken as a result of these inadequately tested vaccines, promoted, in fact, insisted upon by the World Health Organization.
well, Frank, I am seeing patients firsthand who've taken the vaccine and suffered direct damage to the cardiovascular, neurologic, thrombotic, blood clotting, and immunologic systems. I'm seeing this firsthand. Our CDC V-Safe data told us 10 million Americans, 7.7% get so sick they have to go to the hospital, some hospitalized. That's how serious this is. The Zogby survey now a couple of years ago showed about 15% of people are now carrying chronic disabilities due to these shots. They're very difficult to treat. The Biden administration and HHS has spent $1 billion on this. No insightful research. They haven't even started looking at the spike protein. I measure measures related to the spike protein in my practice. I'm using forms of original detoxification and treatment that I've published on. The WHO and related agencies around the world is ignoring my contributions and those of my colleagues who are working directly with patients, trying to help them through this difficult time.
Peter, one of the pieces, and there's so many different aspects to the pandemic treaty and these changes that more or less parallel it to the international health regulations. But one that is particularly alarming to me is that there's carrying forward something that we saw the Biden administration doing on its own heretofore, which is a kind of censorship of the kind of information that you've just talked about. Uh, Talk a little bit about that and the sort of corollary to it, which was the penalties that were meted out
Mm-hmm.
to medical doctors like yourself who had the courage to fight not just COVID-19, but this biopharmaceutical industrial complex.
Well, the World Health Organization has aspirations of developing and further strengthening a biosecurity surveillance system that's going to be centered out of Germany. I can tell you a major aspiration they have is to fight what they call misinformation. Misinformation is not a medical term, doesn't exist in clinical medicine. It's a propaganda term straight out of Nazi Germany. And what they are basically doing is saying anybody who disagrees with the WHO is spreading misinformation, and they want the full force to go after them and prosecute them. I can tell you that means a complete and total blockade on interventions and breaking life-saving treatments that will never get out to the world, because the answers in the setting of a crisis never come from the orthodoxy. They don't come from the WHO or the NIH or the CDC or FDA. They come from practitioners like myself in the field.
And you're living proof of what that looks like. Talk about the kinds of penalties that you were subjected to. Again, even before there was some kind of formal treaty obligation to silence people like yourself accused of misinformation, to say nothing of what we can expect if there is such a treaty obligation as a result of these two documents now pending approval by this World Health Assembly.
Keep in mind, misinformation is not defined. It's intentionally vague. It can't be vetted, and we certainly can't discuss it. So again, this is propaganda. I was essentially terminated from 2 positions for no reason, breaking contracts. I've been stripped of editorships. I was a president of a national organization, stripped of all research grants and opportunities, writing groups. The list goes on and on. It was complete and total. And it's because the biopharmaceutical complex, or this very strong syndicate, and at the head of it is the WHO, is out to crush anyone that stands in their way.
We're going to explore this further in the remaining 2 segments with you, Peter, because I want people watching this program, including, I hope, the vast numbers that follow you closely, as we all should, to have a sense of what's at stake. I've gone so far as to say, meet your new doctor, Dr. Tedros Ghebreyesus, because he will be, as Peter has just described, if given these unprecedented powers, and I mean in the history of the world, unprecedented powers, the guy who's going to be telling your doctor what they can tell you, what they can know themselves, and what treatments you will not be allowed to have, which, as in the case of the McCullough protocol, would have saved your life. We'll be right back with more with Dr. Peter McCullough right after this. We're back. We're talking with Dr. Peter McCullough, one of the great medical doctors in America and indeed the world, a man who has just described to us what he was subjected to for having the courage to fight COVID and to fight for his patients and indeed everyone who was able to benefit from his life-saving McCullough protocol. And Peter, I want to get at something that is fundamental to the topic we're addressing. And honestly, folks, I hope you're watching this as though your life depends upon it, because indeed it does. Peter, the people who are bringing us this empowerment of not just this supranational bureaucracy, which did not acquit itself particularly well, I would argue, not just in the pandemic, but in previous episodes as well of public health emergencies of international concern. But the individual person who is the head of it, the director general, in this case, Tedros Ghebreyesus, they talk about this in terms of global governance, that this is kind of the leading edge of a very remarkable and frankly terrifying new world order. I would say with Chinese characteristics, as Xi Jinping likes to say. As a man who has felt the wrath of these people and in the process watched things like freedom of speech and medical freedom and the doctor patient relationship and then what it was translated into in terms of lockdowns and denial of other basic rights to our people and society. What does this global governance thing mean as you see it, sir? And what are the implications for the Constitution and the Republic that we love?
Well, here in the United States, we just go to the Declaration of Independence, which grants us the inherent, inalienable right for life, liberty, and the pursuit of happiness. That's essentially now out the window with this new global governance. And then once we get into the Bill of Rights, our right to free speech, our right to gather in assembly, our right to bear arms. We can go through all of them. All of them are on the line now because a global governance supersedes any individual nation's principles upon which they're founded. Now, granted, all the countries are slightly different. But for Americans, remember, America and the Western world, the sociological principle that drives us, Frank, is individualism. It's very different than the East and China and Asia, where it's the collective. Well, let me tell you, the new global world order is about the collective and not about the individual.
Yeah. And to the extent that it is about the collective, I guess the kind of the leading edge of breaking us in to all of this is the basis, or the mechanism, I should say, maybe better, by which this whole thing is being um, instituted. There's been essentially no public debate about any
Right,
of this.
right.
There's been no treaties, as I said, no international health regulation amendments that you can review that your medical doctor could tell you is going to be a problem or not for you, let alone, the authorities we rely upon to uphold our Constitution. When you get to this point, in literally a matter of days now, um, Peter, how important would you say it is that the Senate of the United States, among others, stand up and make it clear that none of this is going to be allowed to be imposed,
Hmm.
inflicted, maybe a better
Hmm.
term for it, on the American people without a two-thirds majority of the Senate approving it? And by the way, just as you, I'm sure, know, Peter, a couple of weeks ago now, thanks again to Senator Ron Johnson, who's been such a hero in all of this, the vaccines and the WHO and so much more. Uh, every member of the United States Senate's Republican caucus has said these things have to come to the Senate for its advice and consent. So just your appreciation of how vital that is, given this very dubious way in which all of it is being engineered at the moment.
Well, let's set the stage. Representing the United States at the WHO will be Atul Gawande, who's at USAID, a prematurely retired surgeon, has no experience in public health. Lois Pace, who has a master's degree, assistant secretary at HHS, and John Nakwingsong, who's a PhD originally from Cameroon, who is representing the Department of State. These three individuals have not even had a press conference, have not told us what their approach is. We don't even understand the oversight of those three individuals. And Senator Johnson is an American hero leading the entire Republican caucus in uniformly rejecting the WHO advancement on the treaty alliance. I mean, this is outright, this is stunning. And now 22 state attorney generals are saying, no, not in my state. There's formal resolutions passed. Jeff Landry, personal friend of mine, leading the state of Louisiana. No WHO in the state of Louisiana. So I got to tell you, we are having strong resistance led by the Sovereignty Coalition, other organizations here to say basically, no, it doesn't matter what these three junior staffers do at the WHO convention. We're not going to follow it.
Well, from your lips to God's ears is all I can say, and you're right to call them out because the one public outing that I know of is a hearing that Congressman Brad Wenstrup had, which they were the only witnesses,
Mm.
incredibly, and they proceeded, I believe, Peter, to lie under oath, in particular in insisting that there was not going to be any infringement upon the sovereignty of the United States as a result of what these guys are cooking up. And when I say cooking up, I think it really is important to understand this is not just something that other people, the Chinese Communist Party, Bill Gates, and others are cooking up, as I say, and trying to foist on us. The Biden administration, including these three individuals, is championing this, well, to use Barack Obama's phrase, fundamental transformation of America. We must not let them get away with it. We'll talk more about how we're going to prevent that on the other side of this short break. Stay tuned for more with Dr. Peter McCullough right after this. Welcome back. Dr. Peter McCullough is with us for this final installment of what I consider to be one of the most important programs we've ever done here at Securing America. And I'm grateful to you, Peter, for giving us an hour to have this extraordinarily timely conversation, because within days, our lives will be fundamentally transformed, not just our country, but our medical freedoms, and perhaps our futures may be determined by decisions that will be made mostly in secret in a distant room in Geneva, Switzerland, with three people who may not have our best interest in heart, but are representing us from the United States government. It may be that Secretary Becerra, the Secretary of Health and Human Services, may turn up to sign the deal. I don't know. But what is coming, Peter, for sure, is something that is going to blindside almost every American. And the interesting thing is, we did a poll with John McLaughlin recently, happens to be President Trump's pollster, in which he asked just 6 questions about public sentiment. And nobody knows anything about it, so we just gave them some information to make a response possible. Overwhelmingly, they thought these things were a terrible idea. The sorts of digital IDs and the the censorship and the foreign bureaucrats telling you what to do and the like are all part and parcel of something that is going to be rejected out of hand once the American people find out. The question is, will they find out in time? And will their senators representing them have a say in rejecting these things, as they must? So, Peter, I wanted to conclude with a warning about an instrument that seems to be in the offing to try to panic us into going along with all of this. You've been warning about the avian flu as possibly the disease X that Bill Gates and the CDC and others have been telling us is coming our way, including, of course, Tedros Ghebreyesus. Talk to us quickly about the avian flu, the therapies that are apparently on offer to deal with that, and whether any of this is justification for what we're talking about here, empowering the WHO's Director General.
I fully expect the WHO in the next few days or weeks to declare avian influenza, bird flu, as an international health emergency of concern. It's going to meet their criteria. They're going to make the call. You mark my words. It's going to be just in time for this meeting in Geneva. It's going to put everything on high alert. Gavi, the Global Vaccine Alliance, in 2021 said bird flu, which has been around for decades, is going to be disease X. Former CDC Director Redfield was out on TV, News Nation, yesterday, and was saying that the bird flu is being genetically modified, gain of function research in U.S. laboratories, including the USDA Poultry Research Center in Athens, Georgia. It's going to spread from birds to other mammals. There's already emergency USDA communications out for mass culling or destruction of flocks of poultry, probably will move into cattle. Massive testing going on. There's, in the backdrop, Chinese have been vaccinating birds for 2 decades. It didn't work. The France tried it last summer. It backfired. It's in mallard ducks now. CSL Laboratories in 2021 has a bird flu human vaccine approved with pre-purchase arrangements with the U.S. government. Frank, it's all falling into place. Bird flu or avian influenza is disease X, and it's perfectly timed in terms of all these developments for the WHO attempted takeover.
And you've said several things that just conjure up the problems of the past. The genetic engineering, for example, in biofacilities, not just in China, but here as well. Peter, what could possibly go wrong? Do you think that they will actually devise the mutation of the basic strains of bird flu to make them a threat to humans and then justify thereby these vaccinations? And will we get more jabs ordered to us by Tedros Ghebreyesus?
Just like with Wuhan, Frank, the gain of function strain is already out and circulating right now. We've traced it back to this Athens, Georgia, U.S. Poultry Research Lab. It's a specific clade or strain. It's able to jump from birds into mammals. That's what happened with this dolphin in Florida, with this episode out in West Texas. It's already on the move. It's well documented, and it's just a matter of spreading far enough, and that'll tip off all these alarms for this international public health concern that the WHO will view in their radar. The pre-preparation of vaccines, this mass culling of of animals. What I predict is actually probably not a human threat so much, Frank, as a threat to our food supply. And don't forget, WHO wants dominion over all plants, animals, and humans. So plants
One
and
health.
animals are
One
food
health.
supply.
Yeah. They'll get us one way or the other, I guess, is the bottom line here. Peter, we're down to the last 2 minutes. In your estimation, are there ways of treating
Mhm.
bird flu that do not involve taking more of these, well, genetic therapies and otherwise being locked down or mistreated in manner very much like the China model?
Yeah, the bird flu vaccines will fail. The virus will mutate. The first one is a CSL antigen based vaccine, but right behind it are self replicating messenger RNA vaccines from CSL and from CEPI, the Coalition of Epidemic Preparedness and Innovation, with the Koreans, funded by the Gates Foundation. They will fail. What people need to know is dilute iodine. Nasal washes and gargles work. It kills the virus effectively. I think farm handlers and people who are working with poultry should be doing this now. Again, a few drops of iodine in salt water, spray it up the nose, sniff it back, spit it out, gargle, scope or Listerine with a few drops of iodine. I advise the wellness company, they have a contagion kit, which is extended now to cover bird flu on the first day of illness. People are getting prepared with contagion kits. We need to get ahead of this, Frank, because I can tell you right now, we cannot lock down, have the food supply be threatened, be scared, and be told then the only solution is a vaccine.
Right. Go to sovereigntycoalition.org, please, folks. You can get there through our Center for Security Policy.org site. I hope you'll do that too. Take action. This is not going to doom us unless we do nothing. Peter McCullough, you are such an inspiration, personal hero. I'm proud to call you, as I said, a friend, and thank you so much for taking this time to spread this important and necessary warning. We'll be back with more with the rest of you, I hope, next time. Till then, go forth and multiply.